Cystic fibrosis, or CF, is one of the most common genetic disorders in Caucasians. 30,000 Americans have the disorder, and 10 million are carriers.
I was diagnosed at 6 weeks old. I found out through going into the hospital I had, when I was little, 4 years old, I had pneumonia.
Lung problems are common in cystic fibrosis. The airways become clogged with excessive mucus. Disease-causing bacteria thrive in the mucus, causing chronic infections that scar the lungs.
Gradually, as I got older, we talked about it, and I started asking questions more and more in-depth about what CF is, what it does to me, can other people get it, why did I get it?
The gene that causes CF was identified in 1989. It carries instructions for a membrane protein that transports chloride ions. The gene is located on chromosome 7. A person with 2 mutant versions of the gene has CF. A person who has 1 mutant version and 1 normal one is a carrier. Carriers don't have CF, but they may have some sinus problems. We can represent the cross between 2 carriers like this. Each parent has 1 normal chromosome and 1 chromosome with the mutant gene. When the parental chromosomes combine at fertilization, there's a 25% chance that the child will receive 2 normal genes, a 50% chance that they will receive 1 mutant gene and be a carrier, and a 25% chance that they will inherit 2 mutant genes and have cystic fibrosis. CF doesn't just affect the lungs. A person with CF has sweat that is saltier than normal. Thick mucus blocks the ducts from the pancreas to the digestive tract, and the shortage of enzymes can cause nutritional problems. Even the reproductive tract is affected.
I'd like to have children someday. Of course, I'd like them to be my own. But if that's about 99% of the men are sterile that have CF.
Several times a day, patients must undergo treatment to loosen and clear excess mucus. Traditional treatment involved thumping the back and chest, but there are many newer vibration-generating devices. Research has provided a variety of new drugs. 30 years ago, the average lifespan with CF was about age 5. Now it's about age 30.
I've seen so many advancements just in my lifetime with CF that if things just keep on going the same as they have, I think that prospects are very good for the future.
New treatments are constantly being developed.
Well, when you find the gene for a disease like cystic fibrosis, you have then immediately 2 possible therapeutic avenues that you didn't have before. One is to use the gene itself as a drug. That's gene therapy. The other is to figure out, by studying the gene, how it works, and then try to compensate for its malfunctioning.
Finding the gene has also made it possible for prospective parents to learn if they are CF carriers. If both parents are carriers, they may choose prenatal testing for CF, as with amniocentesis. If the results are positive, parents can choose to end the pregnancy, or they can prepare for the special needs of a child with CF.